Hello, gentlemen. There's a question I receive frequently from men over 60, though more often than not, it's asked in a whisper behind closed doors. Doctor, how often should I be having sex at my age? Is it normal that I can't perform the way I used to? Let me start by saying this. This question is entirely valid, and the fact that it's still treated as taboo, that is a disservice to men's health. So today, we're putting all of that aside. No shame, no embarrassment, just clear science-backed conversation. I'm Dr. Samra Turajilic, your dedicated men's health advisor. Stick with me today, because halfway through our discussion, I'll share a perspective on intimacy that could completely change the way you evaluate sexual fulfillment. If you're tired of myths and misinformation around aging and sexuality, and you're looking for honest answers rooted in medical science, you're in the right place. Before I create the next series of videos, I want to hear directly from you. Tell me what you need help with. Are you facing challenges with your erections, struggling to maintain them, or noticing a drop in your sex drive or testosterone? Or maybe you have concerns about size or overall performance. Whatever it is, this channel exists to support your health, your confidence, and your progress. Your input truly matters. Comment your age, your weight, your country, and the specific topic you want me to cover. Your voice will shape the upcoming content because your well-being is and will always be my priority. Let's start with the basics. Why does sex change after 60? The answer is rooted in biology. And once you understand what's happening beneath the surface, you'll stop seeing these changes as problems and start seeing them as the natural evolution of your body. Firstly, testosterone declines with age. This hormone plays a central role in sexual drive, erectile function, muscle maintenance, and energy. Testosterone levels typically begin to decrease around the age of 30, and for many men, this decline becomes more noticeable after 60. But let's be clear, this doesn't mean your desire for intimacy disappears. It simply means it may manifest differently. Lower libido isn't failure, it's physiology. Secondly, circulation slows down. Erections rely heavily on blood flow. When you're young and your vascular system is robust, erections may be fast and firm. But with age, especially if you're managing conditions like hypertension, diabetes, or high cholesterol, arterial flexibility and circulation diminish. This can make erections slower or less firm. Again, this isn't a personal shortcoming. It's a cardiovascular reality. One recent study in the Journal of Sexual Medicine emphasized that lower penile blood flow is not only a predictor of erectile difficulty, but also an early warning sign for systemic vascular health. Then we have medications. Many necessary prescriptions for chronic conditions, like beta blockers, statins, and diuretics, can have side effects that impact sexual drive and performance. That doesn't mean you should stop taking your medication, but it does mean you should speak with your physician. In many cases, alternatives or slight adjustments can vastly improve quality of life, including sexual function. Finally, psychology plays a powerful role. Many men enter their 60s comparing themselves to a version of who they were at 25. That mental comparison alone is enough to generate performance anxiety, stress, and self-doubt. And as we know from extensive clinical research, stress and anxiety are among the largest contributors to erectile dysfunction. If your mind is working against your body, no pill in the world will completely fix it. These changes, hormonal, vascular, pharmacological, and psychological, do not represent failure. They represent a new stage of sexual life. And like any new stage, success depends on understanding and adaptation. Now let's address the elephant in the room. How often is normal after the age of 60? There's no single answer, but here's what current data tells us. According to studies from the National Social Life, Health and Aging Project, men in their 60s have sex, on average, once to twice per week. That number naturally decreases with age, depending on health status, relationship dynamics, and lifestyle. I've worked with patients in their mid-60s who enjoy consistent, twice-weekly intimacy. Others, managing chronic illness or fatigue, are satisfied with once or twice a month, and some shift to physical affection, emotional closeness, and sensual connection without intercourse. All of these experiences are valid, so long as they feel satisfying and mutual. Remember, Your body sets the ideal rhythm. If you're energized and your desire is present, that's your green light. If you're fatigued or intimacy becomes stressful, it's okay to recalibrate. Sexual health is not defined by frequency, it's defined by fulfillment. One of the biggest misconceptions I hear: Doctor, I only last a few minutes. Am I failing? Absolutely not. Studies, including meta-analyses in the International Journal of Impotence Research, suggest that the average duration of penetrative sex for men over 60 is between 3 to 7 minutes. That's not dysfunction. That's average. But here's the key point. Penetrative sex is just one component of intimacy. Foreplay, touch, talk, shared laughter, skin-to-skin connection can and should last 15 to 30 minutes or more. When you're emotionally connected, physically present, and attuned to your partner, those shared moments matter far more than the duration of penetration. Satisfaction is not measured in minutes. It's measured in the connection, comfort, and contentment you share with your partner. So, how do you know if your current level of sexual activity is too much or not enough? Here's what the body tells us. If you're experiencing symptoms like chest pain, breathlessness, dizziness, or overwhelming fatigue during or after sex, your cardiovascular system may be under strain. That's your signal to scale back and speak with a healthcare provider for proper evaluation. On the other hand, if you and your partner are feeling emotionally distant, disconnected, or disinterested in physical closeness, this may be a sign to gently reintroduce intimacy in a way that suits your current health and dynamic. Let's talk now about how you can support your sexual health naturally and effectively after 60. First and foremost, stay physically active. A 30-minute daily walk can significantly enhance vascular function, reduce inflammation, and support erection quality. As simple as it sounds, walking is a clinically validated way to improve sexual health. Focus on nutrition. Salmon, walnuts, leafy greens, and foods rich in omega-3 fatty acids, zinc, and L-arginine can support testosterone synthesis and improve circulation. The Mediterranean diet has shown strong evidence in promoting not just cardiovascular health, but sexual performance and libido as well. Avoid smoking. Tobacco use is directly linked to endothelial damage, the inner lining of blood vessels responsible for healthy erections. If you're still smoking, your erectile function is almost certainly compromised. Quitting now can produce measurable improvement in just weeks. Hydration matters. Dehydration diminishes energy, concentration, and mood, all of which influence sexuality. Keep water intake consistent throughout the day. Support your mental health. This means letting go of unrealistic comparisons to your younger self. Your value in intimacy doesn't decrease with age, it simply shifts. Embrace that evolution. Speak openly with your partner. Vulnerability deepens emotional intimacy and diffuses performance pressure. Practice relaxation techniques. Deep breathing, mindfulness, meditation, even restorative yoga have been linked to reduced cortisol and improved erectile function. Physiologically, stress reduction restores parasympathetic tone, essential for arousal and erection. Regarding supplements and medications, zinc, vitamin D, magnesium, and omega-3s may help optimize testosterone and vascular function. But always consult your physician before starting anything new. Medications like sildenafil, Viagra, or tadalafil, Cialis can be effective. But if you're taking nitrate medications for heart disease, this combination is extremely dangerous and can lead to life-threatening complications. Finally, let's clear up a few lingering concerns. Does less sex harm my health? Not directly. But recent research shows regular sexual activity may improve immune health, sleep quality, and cardiovascular resilience. While infrequent sex won't harm you, maintaining intimate connection through any affectionate form has real physiological benefits. Can too much sex at this age be harmful? In healthy men, no, but overexertion can lead to muscle soreness, fatigue, and in those with chronic illness, increased risk. Like exercise, intimacy should energize, not exhaust. Does sex stop after a certain age? It doesn't. Sex doesn't end at 60, 70, or even 80. It changes. For some, that means gentle, affectionate touch. For others, it's full sexual activity. The key ingredient remains mutual interest and good communication. Now let's address a few habits that slowly erode sexual well-being after 60. Poor sleep, particularly staying up late, disrupts hormone regulation and reduces testosterone release during deep sleep. Aim for 7 to 8 hours of consistent quality sleep. Alcohol overuse, occasional moderate intake is fine, but overconsumption damages the liver and nervous system, both of which are essential for arousal and stamina. Neglecting chronic conditions, uncontrolled hypertension, diabetes, and high cholesterol all damage the vascular system. Left untreated, they directly impair erection quality. Emotional isolation, loneliness and depression decrease libido and dampen the brain's reward systems. Connection, whether romantic or platonic, is a pillar of long-term sexual wellness. Let me close by saying this. Sex after 60 is not about measuring up to who you used to be. It's about embracing who you are now, with confidence, clarity, and care. You don't need to prove anything. What matters most is intimate connection, mutual joy, and physical and emotional respect. Stay informed, stay connected, and most of all, stay kind to yourself. If this message gave you new clarity or encouragement, consider subscribing for more honest, evidence-based men's health discussions. And let me know, what's one change you're ready to make for your health and happiness? Take care. Your best years may just be beginning.